Right now, let's go to line number 2. Welcome Dr. Benjamin Miller to the broadcast. He's with an organization which he's going to explain momentarily called Well-Being Trust, and he's here to talk about a new report. The report's titled Pain in the Nation. And Pain in the Nation is all about what's going on in America with this opioid crisis, and there's some revealing findings on what we're going to see with drug, alcohol, and suicide deaths in the not-too-distant future. Dr. Miller, welcome to America's Workforce. Thanks for joining us today.
Thank you so much for having me.
A little background here. I see you've got a number of leadership positions, including section editor for Health and Policy for Families, Systems and Health, also a member of the International Advisory Board of the British Journal of General Practice, technical expert panelist for the Centers for Medicare and Medicaid Services. So I get the impression all through your career you've been involved in healthcare and you've been an activist of sorts. Is that what I'm reading?
Of sorts. I'm a clinical psychologist by training, and pretty much the extent of my career has been focused on connecting the mind and the body and looking at ways through both delivery, financing, and policy that we can better address more comprehensively mental health and substance use.
The organization Well-Being Trust, explain that to me. What's that all about?
Sure. Well-Being Trust is a new national foundation aimed to really help advance the mental, social, and spiritual health of the nation. So as you know, foundations oftentimes invest in priority areas, and the priority areas that are most important to us are things that are going to be able to enhance our overall well-being. What are the things in our society, in our communities, and our families that are preventing us from achieving optimal health? And what are some of the things that we as a foundation might be able to do to invest in some of these priority areas to actually help people achieve the goals that they set out for themselves in their lives?
So you're pretty much an advocacy organization then, right?
Well, advocacy is something that everybody should be doing because it's a part of how we move things forward. But as a foundation, we're all about investing in community and saying, okay, what's the best idea that someone in Ohio has to take care of mental health, and how might we play a role in putting resources into that community and helping accelerate those innovative ideas?
So you invest in communities. Where are you getting your money from then?
Absolutely. So our money was a gift from Providence St. Joseph Health System. They said, we need to do a better job in this country addressing mental health and substance use. We need to enhance overall wellness. And so they put a large amount of money into a pot, and they said, okay, we want you to run with this, and we want you to be able to advance the mental health, the social, and the spiritual health of this nation. How can you do it? We're only less than a year old. So we're in kind of our adolescent phase where we're still trying to figure out what we want to be when we grow up. But we do have focus areas. We've got a strong mission. We've got leadership. And we've got the ability to put out wonderful reports like the one we're going to talk about today.
Absolutely. When you say a large amount of money, I deal with Congress. I'm looking at this tax cut. This tax cut is going to blow a $1.5 trillion hole in the budget. Do you have that kind of money behind you right now?
I wish we did. If we had the $1.5 trillion, then we could change the world tomorrow. But no, we have $100 million that was the initial investment. And then we have an additional $30 million that was a part of the merger that existed between the health systems in California that we're actually investing specifically in California. So no, not $1 trillion, $100 million, but still, we're small, but we're mighty.
I like that. It's a step in the right direction, no doubt. Okay, talk to me about this report. It's called Pain in the Nation, the Drug, Alcohol, and Suicide Epidemics and the Need for a National Resilience Strategy. And you've got some pretty revealing numbers in there, don't you?
We do. And this report, for those of your listeners that want to go take a look at it, you can go to the website, paininthenation.org, and you can see a lot of what we're going to be discussing today. But yeah, this report does three things at once. First of all, it looks at the data, and it says, based on historical trends, how have people died in the United States due to drug, alcohol, and suicide? And we project forward based upon what we've seen from the historical trends to say, in the next 10 years, what is it going to look like in our country if we do nothing different? And what we found was that, sadly, we could see between a 60 and 100% increase in the number of deaths in the United States due to drug, alcohol, and suicide. That's a lot of people, considering that the last 10 years, we saw close to 1 million people die from one of those three areas. So this report highlights those data. This report also provides us a really comprehensive kind of breakdown of the evidence. And it gives us over 60 evidence-based programs and policies that our states, our communities, our systems can begin to pursue to prevent some of these avoidable deaths. And then last but not least, we call for the creation of a national resilience strategy. How can we as a country, Ohio as a state, as our local community, become more resilient so that we are able to really recover and bounce back when traumatic events occur, and that we are able to address our health in more comprehensive ways?
Now, these numbers, these are projected if we do nothing or if we're doing the same thing we're doing right now?
Well, one could argue that what we're doing right now is nothing for some of these conditions. The United States has had a pretty tough time addressing mental health and substance use. And if you look at the numbers alone, I mean, we know that in 2015, 43 million Americans experienced a mental health issue, and more than 20 million experienced a substance issue. That's a lot of folks. But if you look at the evidence, most of those individuals didn't get care. Most of them didn't get care, which means that as a country, even as a state, Ohio, we have an opportunity to do something a little bit more progressive to better meet the needs of our community, to better address mental health. And there's no more, I think, egregious example of how we're failing folks and how we're not necessarily addressing all of their health needs than what we're doing with mental health right now in this country.
Well, I saw in the report only 1 in 10 people with substance abuse disorders receive recommended treatment. So we're talking 10%. Why is that number so low?
Well, there's a lot of reasons for that. First of all, there's the obvious one, which is that people sometimes are very hesitant to seek care. There's this thing called stigma. I'm sure you've talked about it on your show before. People are afraid to reach out for care because of how other people might see them. Imagine going to your HR manager or talking to someone at your workplace and saying, you know, I'm just not feeling right. I think I'm either drinking too much or I might be depressed or whatever it might be. And how they might look at you could inadvertently determine whether or not you go and seek care. You may not want to tell your friends, your colleagues, because of how they might treat you differently. That's stigma. And so that's a big issue. That's number one, why most people don't seek care. Number two, and let's be frank about this, the United States healthcare system is a fragmented mess. And so if you have a need that's identified, let's just say you're drinking too much or you're using substances that you shouldn't be using, and you seek care, it's sometimes very difficult to find that care. Most folks, when they are identified with some type of mental health or substance use need, don't go for care. And it's because you have to take off work, you've got to find somebody to watch the kids, you've got to figure out whether or not your health insurance is actually going to support whoever you're going to go see. All of these issues lead to that place in those numbers that you just described. 1 in 10, yeah, but if we're honest with ourselves, that's probably just the tip of the iceberg, because that's only the people that we know about.
Yeah, you mentioned health insurance. Don't a lot of health plans cover substance abuse treatment today?
They do. And 10 years ago, Congress passed a piece of legislation that required health insurance plans to cover what we call parity for mental health and substance use. So basically what parity is that if you have a medical benefit, that your mental health benefit has to be the same. It has to look on paper identical to what your medical benefit is. That's what we would think of as parity. And a report that came out last week showed that unfortunately 10 years later, the United States and most of our health insurance companies still have a very difficult time actually holding themselves to the standard of parity, which means that some people might not necessarily receive services. They might be cut off from services in ways that we legally should not.
Mm-hmm. Let's talk about alcohol versus drugs. Now, as you well know, the opioid crisis, it's getting all the headlines, and rightly so. I mean, people are dying every day because of heroin and opioid abuse. Alcohol, though. Alcohol has been a perennial problem. Where do we stand in relation to those two? Is alcohol still number one? And part of that is the acceptance of alcohol today.
That's right. We don't necessarily look at alcohol the same way we do other substances, and that's a great point. But I have to highlight that alcohol and other substances sometimes do go hand in hand. So let's just look at the data for this one. From 2000 to 2015, we saw alcohol-induced deaths increase by 37%, which is a 35-year high. 35-year high. I mean, these are deaths that could be preventable if someone had simply said, hey, my friend, I've noticed that you're drinking a little bit too much. Sometimes one of the most powerful interventions that can actually occur for things like alcohol are being able to talk about it with the people that you're sitting next to. But to your point, culturally, we've accepted alcohol a lot more than we have other substances. But if we compare drugs to alcohol, the drug overdose deaths have tripled between 2000 and 2015. So we've watched both alcohol and drugs over the last several years literally double and triple in the number of people that have died from that. And yet we stand somewhat idly by. Opioids are getting a lot of attention now because we are seeing an increase in deaths. And yes, there's some horrific stories, and I'm sure you've seen the news just like most of your listeners, where there are parents in the front seat of cars that have overdosed with the kids in the back seat. This is unacceptable. That gets our attention. What doesn't get our attention sometimes, though, is when we hear about another car accident. And you may not necessarily know the underlying reasons as to why there was that accident. It could have been alcohol.
Mm-hmm. Well, there's a lot at play here, and it's all part of Pain in the Nation. When did the report come out, and how's it being? How's the reaction to it so far, Doctor?
The report came out a week ago, and I would say the reaction has been strong. There's been lots of media pickup on this. We've seen some newspapers, actually yesterday in Oregon, a newspaper called out the report and said, we're not talking about this enough. I mean, these are our people. These are not just numbers. Behind every number is a name.
Right.
And that's the thing that we can't forget here. So I would say that, as a policy exercise and an evidence exercise looking at what works and what doesn't, there's a lot of really robust recommendations in this report. But the most important thing, and which is why I'm thankful to be able to talk to you today, is that we as a community have got to do something with this. This is not left just to a policymaker or a legislator or, the smart academic friend that you have down the street to figure out what to do here. This is on us.
Yeah. It's a generational crisis, as you point out in the report. It's huge. Doctor, I have to take a break. Can we talk some more? I want to get into the recommendations. Can we do that?
Absolutely. Dr.
Benjamin Miller, he's speaking on behalf of Wellbeing Trust, and it's all part of a report. You can find this report online, paininthenation.org, paininthenation.org. And it's a rundown. In Ohio, we'll talk more about this, Ohio's drug, alcohol, and suicide death rate could increase 47% in the next decade. You think it's bad now? It's only going to get worse if we do nothing. Back in a few minutes, you are listening to America's Workforce. Welcome back to America's Workforce, broadcast from Ohio for workers around the entire world and archived on awfradio.com. Let's go back to our live line. Rejoin Dr. Benjamin Miller, Chief Policy Officer for an organization called Wellbeing Trust, and he's here to talk about a report that just came out called Pain in the Nation, the drug, alcohol, and suicide epidemics, and the need for a national resilience strategy. Let's talk a little bit more about this report, and it appears to be you did a state-by-state analysis. I mentioned going into the segment here, we're talking a 47% increase in drug, alcohol, and suicide death rates in Ohio. Ohio would have the 11th highest rate in the country, which is, I believe now it's at 13. Who's number one on this chart right now, Doctor?
Well, no matter who's number one and who's number 51, it doesn't matter because we have a major problem in all our states. And so number one actually on the list is New Mexico. And you could go and you can look at the report and you can see the breakdown of how we have classified the states according to the number of people that would die per 100,000, which it's just horrifying. But really, and this is why it's somewhat of a false comparison here, because these numbers still look at your population, and they say, okay, in Ohio, of the 11.6 million people in Ohio, here's the number of people per 100,000 that we would expect to die over the next 10 years. And you're right. I mean, we're looking at Ohio, and we're saying there could be a 47% increase if we do nothing, which is the call to action. Mm-hmm. And if there was anything that we were going to highlight on this conversation today for your listeners, is that all of us have a responsibility to do something with this, because it begins at home. I mean, we had a holiday last week, right, or 2 weeks ago. We had the opportunity at Thanksgiving to sit down and to talk to our friends and our family, to turn to each other and ask the most basic but yet most powerful intervention, how are you doing? If you want to create resilience in communities, it begins with questions like that at home with the people that you're trying to take care of.
When it comes to the states, though, I want to get into like New Mexico. The reason why it's so prevalent there, or the numbers are so high over there. Any reason to justify that?
Well, I think if you look at all our states, but we could talk about New Mexico, is that yes. What plays into some of these problems is much more complicated than just did you use a substance or did you drink too much. There's poverty issues. There's social issues. For example, if you look at some of the states that have chosen to do Medicaid expansion versus those that haven't, we know that those that are still don't have coverage are not likely to seek care. That could play into this.
Okay.
And I mean, in your state being a good example, you have done something with Medicaid. You've been able to expand, and a lot of the folks that have been in the expansion population had an underlying mental health substance use need. And so think about another state that didn't expand or another state that didn't address those access or coverage issues. Those folks that are out there that need care are just going without.
What about the doctors and the prescriptions? I mean, the opioid crisis has been traced to over-prescribed drugs. And when the prescription runs out, they turn to heroin. And a lot of that heroin has fentanyl, has stuff that can kill you. So that chain that I just explained to you, are you addressing that issue as well in this report?
We are, and it's important to call out a couple of things here. And so language matters because language really will change the culture of this dialogue nationally. First of all, simply decreasing the supply of opioids without decreasing the demand for opioids leads people to turn to heroin, fentanyl, carfentanil, things that are available on the street that are much more potent and deadly. And so if we do not do a good job addressing the underlying issues of pain, we are in a major world of hurt here because simply cutting off the supply of medications that people in some cases have become dependent on or even addicted to is only going to lead them to go to other substances. And so that's the one issue. We can't simply look at our prescribers, our physicians, and say, you know what, it's your fault. Because while there is an element of overprescribing, that is not the base here. That's not the fundamental problem. The fundamental problem is that we as a nation, and we call this out in the report, have not done a great job addressing pain. Pain is more than just tissue and nerves. Pain is about how we feel. Pain is about things that oftentimes go into our success. Do we feel like we're doing a great job at work? Do we feel like we're valued and we're loved? If we don't address some of those issues around pain, then we're going to be back here in another 10 years having this conversation, which I personally don't want to.
I understand. Dr. Miller, what about other countries? Have you monitored what's happening in, say, Europe, maybe Australia, other places, the Far East, and how are they handling this situation?
Well, other countries, and this report actually doesn't touch on this. Now I'm just speaking from personal and professional experience here. Other countries in the world have prioritized prevention and other facets of delivery like primary care much more so than the United States. We have a hyper-specialized society which costs us a whole lot more. And as you know, I mean, 18% of our GDP is spent on healthcare, which far outweighs any other country in the world as to how much they spend on healthcare. But yet, despite that, we are still seeing a life expectancy drop for the first time in 2 decades in this country. So we're paying more and we're getting less. And fundamentally, I think the issues that this comes down to is how we as a country can begin to address more comprehensively the whole of health and stop treating people as pieces, but treat them as a whole.
Yeah, it sounds like an endorsement for universal health care in this country. Is that what I'm hearing?
That'll be our next show together.
Yeah, if you have access to health care, there's going to be a much healthier lifestyle, a much healthier populace. There's no question. We've shared that with the advocates for universal health care policy on the show, and it's one that has to be addressed by this Congress. Speaking of which, now has Trump declared this opioid situation a national emergency? I know he was kind of wavering on it. Has he finally gone forward, and does that mean anything?
Currently, the president has described this as a public health emergency, which in essence does very little. It doesn't release federal dollars to allow our states to address these issues. And so, yes, there is more at a federal level that could be done to provide more financial support to our states. But at a local level, a lot of this does come down to how we as a state, and I think Ohio's done a lot of really great things to try and bring the mental health and substance use system up to snuff. We've got to think about how can we more proactively address people's needs before they become too big a problem. That's a local issue. Mm-hmm. And so while the feds can do whatever they want to do in terms of releasing additional dollars, and I don't think any governor is going to say, no, please don't give me more money to help with this crisis, that's not where we are right now. We're still at that place of having this as a major problem, drawing attention to it, but not necessarily being able to have the resources to do something about it yet.
Well, you need the money for the resources, but as you indicated a few minutes ago, there needs to be a conversation. There needs to be a dialogue. It's got to start at the dinner table, and it's got to start with families, pretty much.
That's right. In the report, we call for the creation of the National Resilience Strategy, and I encourage your listeners, if you do want to take a look, while there are some really heavy kind of policy-laden recommendations here, some of the most basic pieces of the resilience strategy are how do we prioritize prevention, and how do we, most importantly, improve mental health and substance use services to address that whole of health that we talked about.
Yeah, I would imagine there was going to be some outreach to schools as well.
Absolutely. And so taking mental health and substance use and bringing it into places outside of just traditional mental health delivery is one of the key components here. How do we integrate into primary care, into schools, into our prison system, so that people are able to get access to care wherever they present with their needs? This is not making them wait and saying, okay, little Johnny, you got to miss school and go over and see your pediatrician now. This is about providing more seamlessly timely access to mental health services so that people have their needs met in the moments that they're presenting with them.
It's all part of Pain in the Nation, the drug, alcohol, and suicide epidemics, and the need for a national resilience strategy. Dr. Benjamin Miller, I thank you so much for joining us here on America's Workforce. What's the next step right now? Are you going to continue to do more outreach on this? Are you going to lobby for more money? Where do we go at this juncture?
Well, there's two next steps. There's mine and then there's yours. I think that for your listeners, the next step is to bring this to the attention of your employer, your local legislator, and talk about what are we as a community doing. But for me, as a chief policy guy that works for a foundation, we're going to be looking at communities and how to invest and strengthen those communities, their approach to address these issues.
There you go. Dr. Miller, thank you so much. I promise to keep in touch, okay?
Thank you, sir.
PainInTheNation.org. Got to check that out.